hope Steve that, or you're hoping that he's going to be here, right?
Yeah, I thought he was.
Can you hear me, John? I can see you.
I can hear you, John. Okay.
Oh, perfect. I was having trouble getting in. I couldn't finally click it on.
Okay. Well, it's 6:30, so we are going to begin. I was wearing my mask. I'll put it back on in a few moments when I finish speaking here. I'm at the board office, everybody, with the Director of Education, Stephen Sliwa, and our Trustee Liaison Officer, Lisa Workman. So good evening, trustees, and good evening, members of the public online. Before we begin, I would like to issue a warm welcome to student trustees Tane Hughes from SFDCI, Go Redhawks, and Jordan Evans from Tugwell District High School, Go Warriors. We anticipate your active participation on the board once you are sworn in next month and look forward to your clear articulation of the student voice. You are getting involved at a most interesting time. Rest assured of every possible assistance and guidance from your trustee colleagues, our staff, and me. Good luck. Folks, like you, I listen to the radio and I watch the TV and I follow social media. The angst and worry and concern that parents are expressing about the reopening of schools is shared across this province and indeed this country, and they're very real. We understand that. We too have kids and grandkids in the system, and the safety of our children is our primary concern. If the answers were simple, it would be a done deal. I'm hoping that this evening's presentations will help to clarify the picture. It is clear that we find ourselves in uncharted waters during this pandemic response. It is also important to understand that all boards are taking their cue from the Ministry of Education's frequent and changing directives. Our staff at the board and school levels are doing their very best to operationalize this plan. The purpose of this meeting is to provide an opportunity for trustees to receive the most updated information on the Upper Canada District School Board reopening plan. To that end, I am pleased to welcome three presenters in the three key areas of public health, school operations, and transportation. Respectively, Drs. Paula Stewart, leads Grenville Lanark District Health Unit, and Paul Rimuliotis, Eastern Ontario Health Unit, our Director of Education, Stephen Sliwa, and Janet Murray, the General Manager and CAO of STAO. We have a limited time of 20 minutes per presentation, followed by 20 to 25 minutes of questions from trustees. Questions from the public are welcome, though time constraints may prevent a direct response to each one. Do not despair, however. The questions may have a great deal of similarity and therefore will be grouped together by our staff and will be answered and or added to the FAQ section on the Upper Canada website. Already there are, I see, 85 questions from the public and something like over 500 or 600 parents observing this live event. So we will do our very best. And shortly I'm going to turn this over to Drs. Paul and Paula. Sounds like a Paul Ankitude, doesn't it? But it's not. I digress. So, Director, I would ask you to take roll call, please.
Thank you, Mr. Chair. Good evening, trustees. This is our roll call for our public session, public information session of Wednesday, August 19th, 2020. Trustee Barry.
Present.
Trustee Crum.
Present.
Thank you. Trustee Danaher.
Present.
Thank you. Trustee Jacobs.
Present.
Thank you. Vice Chair McPherson.
Present.
Thank you. Chair McAllister.
Present.
Thank you. Trustee McRae.
Present.
Thank you. Trustee McDonald.
Present.
Thank you. Trustee Parisian.
Present.
Thank you. Trustee Stewart.
Present.
Thank you. Trustee Swan.
Present.
Thank you. Mr. Chair, you have the floor.
Thank you, Director.
We will get Trustee McAllister. I am on the line. I having a hard time hearing the director with through my mic, so I am on the line.
Yes, we heard you, Trustee Cramp. Thank you.
Thank you.
We're going to get right into the first presentation, and I'm going to turn this over to Doctors Paul and Dr. Paula. So I'm not sure who's going to take over. You have the floor, doctors.
Hi, it's Paula Stewart here. For some reason I couldn't log in, but I'm here on the phone and Paula's going to start.
Okay, Dr. Paul, where you go? Dr. Paul was there. I saw him.
Oh dear. Why don't I start then?
All right, Dr. Stewart, go ahead.
Okay, so Paul and I really appreciate the opportunity to come and speak to you about COVID-19 and school reopening. We started working with the Upper Canada School Board in February, I think, around COVID with international students, and then that has continued. And we've been working really intensely in the last 2 or 3 months with school opening, looking at options and so on. So really pleased to be able to bring this work to you today. So first slide. So we thought we'd just give a really brief summary about COVID because this science drives all the decisions that we're going to make. So the first thing is I think everyone knows now that COVID is spread when someone who has COVID-19 spreads their respiratory droplets through cough or talking or sneezing or probably even singing to someone else who's in close contact. And close contact is within the 6 feet. If you're 3 feet away, it's better. If you're 6 feet away, it's even better. Also, because the virus can live for several hours on surfaces, if you
Is your phone muted?
Ooh, that's all right now? Because the surface can live for several hours on surfaces, another way that you can contact it is if someone with COVID coughs on a surface and you touch your hand and they touch your mouth or your nose or your eyes, then you can get infected as well. Symptoms can take up to 2 to 14 days after exposure to develop, which is a long time compared to most other viruses. Usually within 4 or 5 days, symptoms will appear. The critical thing that we learned in the first 3 or 4 months was that someone with COVID-19 can be infectious for 2 days before the symptoms develop. Asymptomatic infection is possible, but we're just not clear how infectious they are for people who don't have the virus but don't ever actually develop symptoms. And this is important when we're talking about what's going to happen in school. The infection is considered resolved 14 days after symptoms developed, as long as there's no fever and symptoms are improving. So this is critical when we're thinking about children in school who might be testing positive and then how long they would need to be out. Is Paul on yet? No, I'll keep going. So symptoms can vary from person to person and for different age groups. It's interesting, when they initially spoke to us back in January, February, they said they had to have cough, shortness of breath, or a fever. Since then, we've learned that COVID can present with many other symptoms. In fact, there's a common one with a tickle in the back of the throat, and then a sore throat, and then the fatigue, and then the fever. So early symptoms can mimic just about any other respiratory disease you can think of, and that's going to have an implication for how we detect students early as well. The individuals who are at risk, as you've heard probably, are people over the age of 70, and it's mostly because the immune system doesn't function as well when you get older, and also because older adults are more likely to have problems with their immune system. This could also apply to children in a school setting, so it's really important to look at these particular areas, and that is something that we pay very close attention to. I won't go through each of them because you can read them. So the current status in our community. Now, could someone, I've got my own slides here, could someone push on the link to the LGL latest COVID surveillance report? Because this is something we look at every day, and as trustees, I encourage you to look at it every day as well, because this is what will tell you what's happening in the community, and what's happening in the community could very well end up being part of what's happening in the school. So let me know when you got it open. Have you got it open now? Can you see is it at our website? Hello?
No, I can't see it.
No, we don't have it yet, Doctor.
Okay. You should just be able to click on the link, and then I've just done it and it's just gone right there. Well, we'll keep on going. I'll just tell you what I'm seeing here, but please check when you're on your own, because this is what is going to guide us in terms of what happens in the school. So in our region, we had a really terrible April. We had a lot of long-term care homes that had people who were ill. We had 5 or 6 people a day who became infected. And then it really settled down by the end of April. And we've gone a month now without any more cases. Each day I wake up in the morning and thinking this is going to be the day. But this sets us up for Leeds, Grenville, and Lanark very well for what's going to happen when kids go back to school. And in Eastern, it's similar. I think they've had several days now without a case. So you can look at that on your own. So the critical thing to keeping schools safe for students is that we keep community transmission low. So it's the responsibility of every single person in Lanark, Leeds, and Grenville, and in Eastern Ontario to do everything they can to make sure that infection doesn't spread in our community. Usually, children who become infected almost always are infected by an adult family member or another close contact. So it's critical that we as adults really behave ourselves and use all the appropriate precautions. And we've listed here on the slide some of the things, and I think you know them all. They're the things that we've talked about already. Next slide. So we've been using the acronym Be COVID Smart, and these are the measures that have gotten us to this point, helped us move off April into May, and then the quiet period that we're within now. And so those are the ones which are critical to keep on doing within the community to keep schools safe. And they are the basis for the recommendations that the Ministry of Education gave you and we're working on to keep schools safe as well. Critical that if you have symptoms that everyone self-monitors. If you have symptoms of COVID, you stay home and you get tested. The mask or face covering in enclosed public spaces is for, it's called source control. So that's the mask, the cloth mask or the face covering that fits tightly over the nose, the mouth, and the chin reduces the secretions that go from your face out into the community. So it's a source control. And it's critical to make sure that if you did have COVID or early, because you can be asymptomatic for 2 days before, you're not infecting with anyone else. And the province recommended that for grades 4 and up, which I think was a good idea, and recommended it for the younger ones if they're able to do it. Avoid touching your face. As I said before, when there's things on the surface and you touch your face, you could infect yourself that way. And then the critical thing is the 6 feet apart. The kids, when their report, they actually said that they thought that 3 feet was enough. The research shows that if you're 3 feet away, the risk is lower, but it's even lower if you're 6 feet away. So we're really encouraging 6 feet away. The province talked about social circles where people can be really close to each other. This is going to be a two-edged sword when we go into schools, because if you have 10 people, say 2 families who are part of a social circle, and the commitment you make in a social circle is that you will be very careful not to do something which could get you infected. But now we're going to have kids going to school. So it's going to be interesting. It's still really, really important that the adults that are part of the social circle really take great care that they don't become infected themselves. And then the hand hygiene and the covering coughs and sneezes. Okay, next slide. So COVID in children is a little bit different.
Paula, I'm here.
Yeah. Oh, you're there. Okay, Paul, you're on.
Sorry, everyone. I've been here for a while. I wasn't able to hear it. I had some technical issues. Anyway, I can hear you now, and I had to go to a couple of computers. I apologize. I just want to. I was hearing. Finally, I heard your last 5 minutes, Paula, and I just want to reiterate that what you showed in terms of your numbers, we are down as well. We had a surge in March. We had, unfortunately, some deaths in our area, but again in long-term care facilities. But the most important thing for us to have a safe return to school is that we can collectively, with the mask wearing, with everything else, ensure that we keep the community levels down. That way they won't get into the schools and they won't get into our long-term care facilities either. But I just wanted to sort of summarize and support what Dr. Stewart was saying. So COVID in children, just to give you a bit of a background, I'm the medical officer of health of East Ontario Health Unit. I'm also the chair of COMO, and I sat on the committee that reviewed with Deputy Minister Naylor the guidelines that you have. And I'm also a pediatrician. I was former director of the outpatient clinics at the Montreal Children's Hospital and professor of pediatrics at McGill. So I really do understand both the public health aspect of this as well as the pediatric aspect of this. So essentially in children, one of the fears that we had initially, I must say, is that, as you know, with the flu, it's the sort of the outer edges of the age groups that are more susceptible. So it's usually the younger children or the elderly. And we feared that would be the case with COVID as well. The other issue with children and any viral infection is that they tend to be reservoirs, they tend to be sources. And we do know that when we're monitoring schools for outbreaks, it's inevitable that if a school gets an outbreak, we will see some community spread as well, starting from there. So those are the two reasons that we worry about kids and COVID. Particularly viral illnesses, but particularly in the situation COVID. So we know now from what we've seen that although there are the rare, and there have been several hundred deaths in the United States in children, we know now that it's a mild illness and they recover well, and likely in many children they're what we call asymptomatic or minimally symptomatic, and can, and then the fear there is that they will inadvertently spread it. Again, there are, like anything else, any child who has other chronic medical conditions, immunodeficiencies, chronic asthma and so on, may put the child at a higher risk. And this is why it's important to evaluate those children. And And we're not sure, like, are they less infectious than the youth and adults? We're not sure. We think so. But again, as we see the numbers increasing, we'll have better information moving forward. And again, the symptoms can be very nonspecific, could be fever, difficulty breathing, loss of taste of smell, sometimes very difficult to ascertain from a smaller child, younger child. These are very non-specific symptoms. And so that is one of the challenges that we have, because as we go into the flu season, into the cold and cough season, there's a lot of overlap. Can you have the next slide, please? There we go. So, when we talk about the benefits and we talk about sort of some of the benefits and some of the unwanted consequences of closure of school, of pandemic response, we really have to weigh, it's a balance, right? It's a balance between risk and benefit. And, no doubt about it that when you're in the middle of a pandemic, when the numbers start to surge upwards, like the United States we're seeing and in other countries, that is the time that you need to be, the balance is very easy. You don't want to expose many people. You want to lock down as much as you can. So, and that's easy. So the benefit at that point in time will really outweigh the risk. The benefit is that you're saving lives and you're saving infections. And the risk at that point really is that you're depriving these children from going to school. But on the other hand, you're saving lives. Now that we've gone into a phase where we're out of phase one, the first pandemic wave, we're now getting into what I call sort of sporadic community spread. And by the way, a lot of the cases today, the caseload was up by 100 cases or so. And again, most of them are really focused on either farm outbreaks or outbreaks where people were not masking and so on. So it's important for us to keep that in mind. So when we talk about the parent making a decision, again, we know that students' education and well-being and growth and development is very important. As a pediatrician, I can tell you that certainly that's even more pertinent in younger children. And as they get older, obviously there are other benefits that they have, ranging from socializing, developmenting, social interactions, and so on. There's a whole slew of benefits in terms of going to school, consistency, stability, and we also so those are sort of why you want to send the child to school, and obviously why you don't want to send the child to school is you don't want the child to be sick and or to bring COVID at home. And so this is where we have to balance as well. And when we look at these things, we have to look at the risks and we have to look at the benefits. And I can tell you right now, and I was quoted on CTV this morning, that there is no guarantee that we will not have more infections. There's no guarantee that we will not have infections in schools or other areas. But what we want to do is we want to decrease that risk as much as possible, mitigate it as much as possible. There's going to be some close contact, and we know that in other countries, and when I did the review with the public health measures table, we looked at many countries that had successes, and we saw that the more stringent the guidelines were, the more stringent the precautions were, the less that there were outbreaks and the less there was transmission of COVID-19, which is obviously our collective goal. So we want to balance that and ensure that parents understand that we're trying to mitigate that risk while particularly after kids miss school for March, recognizing the importance, particularly in young children and others with learning disabilities and so on, the importance that consistency, that face-to-face teaching, that interpersonal interaction, social peer development, and all these other things. Next slide, please. This is still mine, Paula? I've lost track. Yeah. So again, minimizing the risk. So these are the public health measures, and these are the public health measures. Like there's really no sophistication behind these things. It is very, very simple. It is really an extension of what we have been doing collectively as a community, as a society, since March 13th, when everything was declared, the emergency was declared and schools were closed, where again, we have to look at daily screening to ensure students and staff, and this is a policy we've done everywhere. I mean, workplaces, if you're sick, you don't go. Prompt isolation of sick children and staff while at school and the response. Again, this is part and parcel of what we do anyway. We've worked with many of your schools and many other school boards collectively to be able to support them. We will be getting those extra nurses as well that will support our liaison with our school partners. Cohorting of students, again, putting them together. The cohorting really is one example of the cohorting that came out was the social bubble. That's a cohort. Putting kids together means that if you do get spread, you'll get limited spread within these children. Essentially, they're like another bubble. However, we want a physical distance to the largest extent possible. I want to stress that I, on the public health measures table, along with my colleagues, recommended to the government that it should be a 2-meter distance, not a 1-meter distance. And I want to make that clear. Frequent hand hygiene, enhanced cleaning and disinfection measures, and good ventilation. And obviously, what's become new, if you compare it to, like if I were to give you this talk back in April, I would tell you the same exact things, except I would not have talked about face coverings or masks by students and staff. The reason we do that is because you all know that we jointly ourselves, Leeds, Grenville, Renfrew, and Ottawa, jointly put out a mandatory masking. That is because we now better understand this is a novel virus, and we better understand how the virus spreads. It can spread several days before you become symptomatic, and in some situations, you don't have symptoms at all. So that accounts probably to 30 to 40% of the cases. So you can see what we were doing in March or April, where our guideline was to, let's say you got sick today, we would say, okay, who were you in contact with today? And from the day that you were sick on forward, who were you in contact with, when symptoms onset. After we realized that you can get pre-symptomatic transmission asymptomatically, we now have changed our approach, and we're going back 48 hours. So we're saying, okay, when did you get sick? Okay, I got sick on Monday. Okay, who did you get in contact with? The Saturday and Sunday. So we go back, and so when you're looking at the masks and why we're doing them, as Paula had said, you have to understand it's a source protection. There are different layers of masks and different types of masks. So for example, the masks that you're seeing now here are essentially cloth masks that prevent those kids from spreading any germs that they may be harboring in their respiratory tract. Okay, that's what it does. PPE for teachers and healthcare workers and so on are actually to protect them from the virus getting into them. Obviously, both ways, but this really protects the source. So so if I wear a mask, you're protected. You wear a mask, I'm protected. We all wear a mask, everyone is protected. And that's the bottom line. We struggled with the table to determine, should all kids in school wear it? Should kids only in high school wear it, or halfway through? The government decided to go halfway through. Many reasons for that. One is the kids' dexterity is easier to control. Put it on properly, not properly, improperly. Grade 4 and above. That was sort of an arbitrary thing. In Quebec, it's grade 5. So those are the things. So that's why now, with face coverings added to this, I am very confident that we'll be able to successfully prevent out of control transmission. Again, this is to minimize the asymptomatic transmission, and this is a new sort of layer of protection that we've added that are now incorporated into the schools. Paula, I think you're next.
Yeah, thank you. So a little bit on how public health will work with the schools. As I said, we've been regularly meeting with the director and senior management, and I've been attending the principals meetings. We'll do it again tomorrow morning. We've had a joint school planning committee in place since July. They've been meeting regularly to really hash out some of the operational details. The province announced that every health unit would be given new public health nurses, additional nurses, who can actually work directly with the schools in the development and implementation of their health and safety plans. We were thrilled with that because our nurses work closely with the schools now, but one nurse may have 7 or 8 schools. So this way, with the additional nurses, hopefully they'll have 2 or 3 schools, and they'll be present in the school. They'll be helping the staff, the principals, everyone working in the school about their infection control, prevention and control measures to start with. They will help with the surveillance, keeping track of kids that are sick and why they might be sick away from school, support parents in the screening. And then if there is a child who does have symptoms that could be COVID, they'll support the testing of the child. If the child does become positive, then they will support that child to stay at home, and they'll do the rest of the contact management at the school. They'll work with the teacher to identify who would be the close contacts and proceed from there. And the next slide will tell you a little bit more about that. They'll also be involved in communication engagement with parents and local communities. There'll be a connection into the health unit and all the rest of our programs. So we're really excited about that. It builds on the connection that the school nurses already have and enhances it so that we can do even more. Next slide. So a little bit more about case and contact follow-up. We've been doing case and contact follow-up with infectious diseases for a long, long time, whether it's measles or pertussis or influenza or whatever. So it's the same principles basically, and we've really honed our skills with COVID since March. So as we said before, if a student or a staff tests positive for COVID-19, they must isolate at home for the 14 days. And the public health will be contacting them regularly through that time. We'll provide also specific advice to the school on measures that need to be put in place to prevent the potential spread. That will include cleaning, that will include identifying which kids are close contacts, as you can see on the next side of it. The close contacts will have to self-isolate for 14 days at home and be tested. And we're expecting that they could participate in virtual learning if that works out for them. We will inform the parents if there's a case. We will work with the school to decide how to inform the parents, and we're working those details out. But the parents of a class, the parents of children in the same class as the case will be told that there was a case within the class. They won't be told who for confidentiality reasons. And also in the parents and all the rest of the school will be told that there was a case in a class. They won't be told any details for confidentiality. So we're hoping that that will reassure parents that they will know what's going on in the classroom. The close contacts will have to self-isolate for 14 days, and then the low-risk exposure, so people who might have been exposed, but as Paul said, greater than 6 feet away, we'll call them low-risk exposures, and they'll be asked to monitor for symptoms. The public health will be calling them, especially the nurse at the school would probably be contacting them, and they'll get tested if symptoms develop. So this works well for us. We're just adapting from what we've used elsewhere. Last slide, next slide. So a little bit about school transportation. We've been working with the Eastern Ontario school buses and really encouraging. We know that some parents are going to drive their kids to school, which is fine because then it will leave more space on the buses. We really hope we could have 1 student per seat, but that may not be possible. So we're really recommending that that the students in grade 4 or 5, they're required to wear masks, and we're highly recommending it for younger children. We live out in the country and my kids go to school in Perth, my grandkids, and I know they're on the bus sometimes for 40 minutes. So when you think about it, that's 40 minutes of close contact with others. So we think it's critical that they have that source protection, like Paul said. And the buses will be assigning students to seats, and there'll be a record of the students on each bus so that if there is a case that was on that bus, we'll be able to identify exactly who would have been in close contact. The bus drivers will be wearing a medical mask and a face shield, and they will do regular cleaning of the bus. So the bus driver will have the protection that Paul mentioned, both to protect them from the students and also protect the students from them. So we think that's going to work well. Before and after school programs that a school has, it's very interesting. We've been thinking a lot about this. Students in those programs would actually be part of 2 cohorts. So we're hoping that if they're actually in the school, that they try to keep the classes together in a cohort and families together so that we minimize the interaction between the different cohorts. And any child that is part of the before and after school program will be, they'll be noted, they'll be registered when they were there, so that if we do need to do contact tracing, we'll have the information right away. So last one before the end. I know some schools have childcare centers. We've been working with childcare centers all summer and really have finessed a lot of what needs to be done with them. We recognize that it is critical to allow parents to return to work, so it's important that the childcare centers function and that we keep kids as safe as possible in them. So we'll continue to work with the childcare centers to support the infection prevention and control guidelines. Once again, if there's an infected child or adult, we'll do the follow-up and the contact tracing just as I described with schools and all other measures as needed. And then we'll be communicating with the board, the school, and the families. So final thing going forward, we have learned since February that the most important thing is close collaboration by everyone, and that includes the students and the parents. That's absolutely critical to make regular school attendance possible for those who choose to do it. And we recognize that some parents may not choose to do this. There's no right or wrong answer. I know some parents may be listening. You need to choose the answer that's right for you. And we sent a letter through Facebook and Twitter and so on. It's up on our website for parents that can help them decide what choice is best for them. We in public health, both of us, are committed to being an active participant in this collaboration. Paul and I are in regular communication with both directors and are really pleased to be part of that. Basically, every community member can help in this by following public health preventive measures so that they don't become sick, they don't infect their kids or other kids, and we keep the virus away from school. Thank you for letting us come. And the last slide is just if you have more questions, and be very pleased to answer questions now.
Thank you very much, Doctors Paul and Paula. I would now open the floor to trustees. If you have one question at a time, please, and then we'll go to the next trustee. I don't see a chat line, but I will take questions now. Trustee Swan.
Hi, I have a question for Dr. Paul. You mentioned about masking and the guidelines, and that, if I understand it correctly, the province was the one that said grade 4 and up will be wearing masks, basically. But what is the actual health unit's opinion on mask wearing for all children of all ages? Because I know they're required to wear masks in stores, etc. So I'm just kind of wondering, what is the health unit's opinion on masks for JKs to grade 3?
Dr. Paul, could you unmute?
Sorry about that. Yeah. Well, I can tell you that I have ambivalent feelings about that. Depending on the context, I believe that younger children, if not supervised, like depending on where they are, may or may not have the capability to properly put on a mask. May do more damage than good. And so it was a matter of dexterity and so on. And it was I have to tell you, it was an arbitrary number. However, I was more comfortable if the lower the class number, the less aggressive I will be with masks in that setting. If you're able to social distance in a class and control that, I think that's fine. I know that you have to understand as well that for younger children, even we exempt them. A younger child or a child who has other issues, we exempt them. I know that there's recommendations for masks 2 and above. I know the American Academy of Pediatric has done that as well. I'm not sure how enforceable or practical it is for all children to wear a mask in the class. And this is why I'm very, very focused with our school boards and all of our school boards that the younger children that are not wearing masks, that's where it's imperative that physical distancing is maintained.
Thank you, Dr. Paul.
Could I add to that? Is Paula?
Yes, go ahead, Dr. Paula.
The difference between a child being with a parent and going into a store with a mask on is that the parent is there to supervise the mask going on and how the child behaves with it. In a school setting, it's a little bit different. So I think that reflects what Paul's saying.
Exactly. That's exactly what I meant. Yeah.
Thank you very much. Next question from a trustee.
May I have a question, John? It's John McCrae.
Go ahead, Trustee McCrae.
Thank you. I just want to feel confident that if something happens and there is an outbreak, that it won't be just educators that are standing before the public. It'll be the minister or the health units, and I sort of feel confident. Would you both of you reassure us that will be the case?
I want you to speak to the Catholic School Board and talk to them about how we stood in front of them when a child died of H1N1. I say no more. I led the press conference, and I took it all, and that's what we're going to do as well. We're not going to let you alone. If that's not confidence enough, I can't tell you anything else.
Yeah.
Next question, please. Go ahead, Dr. Paul.
I totally agree. I know from their experience with long-term care and stuff that I did a ton of media about it, and people are gonna look to us, to Paul and I, and we will be there right in front. I guarantee it.
Yeah.
Thank you. Next question.
I have another one.
Are there any other trustees? First, Trustee Swan. Okay, go ahead, Trustee. Go ahead, Trustee Swan.
Hi, I just like it says to wear masks, and I'm a huge mask believer for all that can wear them. But I just wanted to say I had emailed, actually this is probably for Dr. Paula, because I emailed your health unit for a statement on vented masks and noticed that Brockville now says they aren't allowed in the hospital. And I just wanted to know why there hasn't been more clarification on that out there in regards to which masks work and which ones don't.
Paula, so I'll take that back and we'll look at what's on the website. The concern about a vented mask is that you're actually expelling through it. We've been working with your school board around masks for hearing impaired children where they need to be able to read lips. And we've asked the ministry for a guideline on which is better, a face shield or a mask with a clear area in it. I think that having a mask with a clear area and a face shield is probably going to work, and I think that's maybe what you've landed on. So there are all sorts of little idiosyncrasies that we have to think out together.
Just a clarification, because that's not what I was asking. They have these masks out that have vents in them that I have read. Basically, you might as well not be wearing.
That's exactly what we meant.
Yeah, that's what I was trying to say. Yeah, we'll make sure that's really clear on our website.
Thank you very much.
John, may I have another question if there aren't others?
There are others, John, if you don't mind.
Okay.
I'm going to go to a member of the public here. And the question is for
Trustee Jacobs first.
Trustee Jacobs?
Yes,
Go ahead, Trustee Jacobs.
what are some of the through the chair to the doctors, what are some of the things that we can inform the parents about if the younger years that aren't required to wear masks? What are some of the information that would be helpful for them to be more comfortable with having their child go to school without a mask or not being required to wear one?
First of all, I don't want to say that we recommend, if they want to, we're not prohibiting it. I mean, they can put the child, if they feel the child can wear the mask, for long periods of time, that's fine. I would be very comfortable in saying that, and that's what I'm adamant about, that there are precautions in place to ensure that the physical distancing is enforced, particularly younger children. It's harder to do, but that's an onus on the board and the supervisors that are supervising the class.
Thank you.
Dr. Paul or Dr. Paula, I have a question from the public, and the question is this: if 6 feet apart is critical, as per the doctor on this call, why aren't students positioned 2 meters apart in the classroom?
With Paula, maybe I'll start with that. We've been talking to the school a lot about that. Part of the when the province made the decision that it was important to enable all students to attend full time, and we were one of the regions because our rates of disease are so low that they offered that too, then it becomes a practical thing of how do you actually get all the students in the classroom. And so this is one of the reasons why masks, particularly in the older grades, where I think they can use them very well, it's going to mitigate against people being even a little bit closer than that. So it's a sort of a practical thing. So as far apart as possible is probably the best that can be done. And I think it's pretty good because, as I said, that there is evidence that if you're 3 feet apart, it makes a difference, and it makes a difference a little bit more. So even if they are 3 or 4 feet apart, it's going to be so much better than if they were a foot apart. And then the addition of the mask and the staying home when sick and the coughing into the arm and the washing your hands, it's a whole composite of protective measures that will make a difference.
You're muted, John.
Thank you. I have another question from the public here. If a student or teacher were to contract COVID-19, would the whole class be sent home for 14 days or just the person who has the virus? And if the whole class was sent home, would all the family members of every single student and staff member from that class have to stay home as well for 14 days?
Okay. Well, first of all, the initial answer is likely not, because we'd have to do an assessment. We'd have to see, okay, when did this person get sick? When was this person contagious? What contact did that person have? What was the intensity of the contact? So you see, the risk, we have to look at the risk. Is it a low risk contact, high risk contact? And that depends on the proximity, duration, and intensity of the interactions. So I'll give you an example. We had a bus full of people that left Montreal for Ottawa, and 2 people were tested positive on that bus. And so we did not, we went to, we said, okay, where were you sitting? I was sitting here. So we looked at the 4 seats all around them, and those were the close contacts. Everybody else was fine. We just told them to socially monitor. Nothing happened. Nobody else got it. Those 2 individuals got it. So just to show you the type of approach. So if you're talking a couple of kids in the same class or a cluster of cases, that's a different situation. So it would depend on the situation. Obviously, looking at the initial contacts, and then have a layered effect on the others that were not in contact at all. So if we, for example, announce that a staff or a student was tested positive in your school, and you never even were in the school or in the vicinity of that classroom, there's no issue. So we really need to layer that information out if we have a positive case, to really ensure that the public understands that that individual was only in that space at that given time, and it's only a small amount of people that are isolated. If the families of the contacts, then it's just monitoring the symptoms. But this depends on the individual situation. We will not. There's no single protocol that says, yes, you do this, if this happens, you do that. We have to base it on our contact tracing, and that's what we'll be doing. That's the most important part of really trying to ascertain when the individual got sick, when was that individual in contact with others vis-a-vis when the symptoms started. So it could have been that this individual got sick. I'll give you an example. Got sick on Saturday, but wasn't in school 2 days earlier. And so those 2 days earlier, there was minimal contact. But if the individual got sick on a Wednesday and was in school on a Tuesday without symptoms, then that individual was contagious. So you see, there's multiple factors that play a role here.
Thank you. I have a question from a parent, and it goes like this. If my child gets sick with allergies, cold, or other symptoms similar to COVID-19, will they be required to get tested and isolate?
Okay. Can I take this, Paula?
Yes, please.
I'm the pediatrician here. So that is something that Paula and I and our teams have been working on. We do recognize that there's going to be, let me put a common cold aside. Let me just talk about chronic conditions like allergies, asthma, hay fever, those type of things, kids that would have chronic symptoms. We're trying to make sure that within our screening, or the screening tool that we've developed together, that parents have the ability to say, okay, and the school should understand that, you know, little Johnny has asthma, so he'll cough from time to time. So it'd be important for us to make a judgment at that point. Well, that's, the parents will say, yeah, that's normal for Johnny. And then if something out of the normal appears, then we will take it that perhaps it's COVID or something else. So there are mechanisms in place, and that should be very clearly described and discussed with the school, and children with asthma or other chronic medical conditions that have symptoms that are chronic. We should be aware of those. Parents will be aware of those, and our checklist on whether or not they should go to school will tell them, if you will ask them more deeper questions as to, is this new, is it different, or is it usual? If it's usual, then they can go to school. When it comes to a common cold, this is where the problem will arise, because we know that kids will get colds, particularly the younger ones, and this is where we're going to have to assume that it is COVID, and this is where we're going to be managing it together. We're either going to ask the child to be tested, and if the child tests negative, then the child goes back 24 hours and it's fine. So those are the things that I'm hoping that very shortly we'll be able to do quick tests. You know, unfortunately, the test that was approved, that's on the spot test, gives you a result right away. This will be very useful in these situations. But if we do suspect with any of the symptoms, obviously the first thing we'll do is the child will stay home. We'll test the child. If the child's negative, then the child can go to school. So that's the way we're going to be doing it.
Thank you. I'm going to move to Trustee Swan. You have a second question?
Yes, I'd like to ask about hand sanitizer. I know that it's recommended that soap and water 20 seconds is recommended, but with the schools and the use of hand sanitizer, I've had many parents concerned about this and how it can affect children. And I know there was a recall on a bunch of them. So I'm just wondering what is the effect of hand sanitizer on children, especially young ones with, you know, that are smaller?
If they drink it, it's dangerous, obviously, and I'm not being facetious. I've had kids come to the emergency room having drank it, so that's one danger. I do not believe there's any danger if it's used appropriately, and in the context that would be any danger. There were some people were saying, well, it kills the good bacteria. I don't think there's a lot of merit to that. Other than, I'm serious, younger kids drinking it, I don't see a big consequence.
Well, thank you. And I'm not a doctor, so I didn't know how to answer that. So I appreciate that. Thank you very much.
I have another parent question, doctors. What does the health unit propose classrooms do when social distancing of 1 to 2 meters is not possible?
Paula, can I start with that?
Yeah.
So I think that's where all the other measures are important. So that's where we make sure that if a child has symptoms that could be COVID, they don't go to school and they're tested. So that's the first thing, is that we hopefully eliminate the virus from coming into the classroom. The second thing is that there's source control by having the mask on for the older kids. That kids, if they do have a cough, they cough into their arm. That there's frequent hand washing, there's cleaning being done, that children are kept together in cohorts within the school so that there isn't a lot of interaction between other children. So it's really the whole package of measures which are going to make a difference.
Thank you. Trustee McCray, you had a second question?
Thank you, Chair McAllister. I would like an opinion from the doctors on active ventilation and the outside air coming into the rooms. Thank you.
Okay, it's Paula. Could I answer that? Because I got the question from one of the trustees. So I did some research on it. The benefit of being outside is that whatever secretions come from your mouth are diluted by the outside air moving around and stuff. And so the same principle applies in the classroom, that if you have a lot of air coming in and out, it's going to dilute whatever might be in the air. There has been several examples of COVID being spread in enclosed spaces, like really enclosed spaces, people close together for a long period of time with very poor ventilation. And so that's the reason the province put in the importance of having regular air exchanges, having windows open. So it's really about having good air exchange that can dilute whatever might be floating around the air from people's coughs and their sneezes before it lands on the ground.
Doctors, I have another question from a parent. Will the health units be increasing testing sites to facilitate the increase in testing that will result from schools reopening?
I can answer
Paula,
that.
could I answer? Okay,
Go
you go
first.
ahead. Yeah.
Go ahead. No, go ahead. We were on the same meeting yesterday, so go ahead.
Yeah, so I'm actually sitting on the Ontario East testing committee that's looking exactly that we actually had. That was a big meeting we had that Paul and I were at earlier, and then I had yesterday. So we're actually looking at options for how we would do testing if there was a case in the school and we need to test them or part of the classroom. And there are many things that are being considered. First off, the students could go to one of the assessment centers, and students will be prioritized if they have symptoms. So I think that's going to make a difference because we need to get students tested quickly and we need to get the lab results back quickly. We're also looking at in Lanark East Grenville, we've put in proposals for a community paramedic mobile program so that the community paramedics would be able to go from community to community, to school, or if like we live near Perth and my grandkids go to PDCI, and they're kids that go from many different communities into PDCI, so that we could actually set up testing sites in Lanark Village or other places as well as in Perth. So we're really looking at options to make testing really easy for people so that we can get kids tested quickly and then hopefully back to school. Paul, go ahead.
Yeah, I just want to say that we're not going to be testing routinely. I mean, the asymptomatic testing will not happen. However, we will be for depending on the requirements. If we test a child or two, then we can bring them to the nearest assessment center. By the way, we have 7 in our area, so I think that's plenty, and that we have a lot of access to ours. However, as Paula said, we already in Eastern are working with our paramedics anyway, and we deploy them to certain areas. We deployed our paramedics to the long-term care homes, and they did the long-term care homes. So we, if and when required for us to go into a school and test a school or test a classroom, we will be able to arrange it that it'll be done on the spot there. So that will mitigate any travel requirements or any lineups in assessment centers and so on. And we've had a lot of experience doing that. Our paramedics have tested thousands of people that way.
Yes, just Paula, we did the same thing. It's a wonderful, wonderful thing.
Thank you. And for our final question on this segment, the question is from a parent. My son is severely autistic and will not wear a mask. Do I need a doctor's note?
No. No, there's no requirement for proof.
Okay, thank you very much. Dr. Paul and Dr. Paula, thank you very much for the presentation that you've made to us this evening. That I think it has been informative. And we will be adding many of these answers and questions to our website. So thank you both very much.
Thank you.
Thank you. Bye-bye.
So ladies and gentlemen, we are now going to move to our second presentation, which is an update from the senior administration, beginning with our Director of Education, Stephen Sliwa. So Mr. Sliwa, I'll turn this over to
Thank you, Mr. Chair, through you. We want to confirm that building from the presentation to the board.
Go ahead.
Building from the presentation that the board received last month, Mr. Chair, where the staff provided the draft at that time school reopening plan. A number of different steps have taken place since then, including consultation with the Ministry of Education and further discussion with the public health units, as you've heard this evening. And so we are now moving from the school reopening plan to a range of operational guidelines that will be important for the clear and safe operation of our schools and our different programs
that's important. I'm just going to ask Derek if he could advance the first slide. So since the end or mid part of June, trustees, all school boards in Ontario have received a number of formal and informal updates. What's shown here on your screen is the formal updates that all school boards, including the Upper Canada District School Board, has received as recently as last evening about preparing for the reopening of schools. And what that means for us as a staff is a need to be updating and revising our operational guidelines, including the one that was released last Friday on August 14th. The guidelines that are and guidance being provided by the province does relate to those three factors that you see bulleted there around routines for schools and classrooms, health and safety protocols, as you heard from both Dr. Paul and Dr. Paula this evening, that they are being consulted at a provincial table, and the provincial table transfers that knowledge and dialogue to the Ministry of Education. The Ministry of Education then provides guidance and direction to schools and school boards. And then lastly, a greater development that has taken on more prominence over the last 6 to 10 weeks has been providing parents with choice around remote learning concurrent to the opening of schools. So what that means, trustees, is that while the Upper Canada District School Board has always had distance learning or e-learning, which was asynchronous or not offered in real time in our schools, the province of Ontario is now expecting that all school boards, including the Upper Canada District School Boards, develops a parallel, synchronous, in real time virtual school, that if parents choose that for their children, that we are required to be operating that program alternative, as well as our standard in-person school experience. Next slide, please, Derek. Bolded at the top of this slide is really our focus as a senior administration, because it is the focus of the Public Board of Trustees, and that is to make sure that we have a plan that is safe and clear for everyone involved. So obviously we're serving our students. Obviously we have an obligation to support our staff in terms of a safe workplace. Obviously parents are interested in how their children are going to be attended to at school under these unique circumstances. And obviously as an employer, we want to ensure that our staff are properly cared for, as well as our students, so that they can continue to do the work to welcome and care for our students. So the focus that we're really looking at then, since the provincial guidance was provided in June and again in July and again in August, is how we're operating schools and school sites, how we're creating virtual learning and a virtual school for parents who have decided that they would not want their children to attend in person during this year, or at least at the start of this new school year. And then also supporting all students, including students with special needs, because we're recognizing that our children have not been in a regular school day environment for 5 months. And so we're trying to move from what was really emergency online program and services to now back to our standard model of full-time, 5 days a week, 6 hours a day of school for children, which has always been the mainstay of the Upper Canada District School Board and all school boards in Ontario, and at the same time energizing and focusing on our commitments to build a virtual school that has a parallel structure and parallel programs to what's happening in person. I do want to make sure, though, trustees, and you'll see this evening, that by its very nature, a virtual school is not the same as a face-to-face in-person school environment. but there are characteristics that we're being asked to replicate, and we'll do our very best, of course, to honor that commitment. So our operational focus, as you see at the end of that slide, trustees, continues to be preparing our school sites right now, preparing for our return of staff and for the training that they're going to require, starting with our principals this week, helping our students to feel prepared and ready for a new school year of learning. And you'll hear from Superintendent Perry about some programs that we've been operating this summer, including what we'll be doing next week to prepare our students. And of course, to track and report to the board on incremental costs that are projected for the new school year, given some greater expectations, and now operating a parallel virtual school as well as our regular day school environment. If you can move the slide forward, please, Derek. And this next slide is just a reminder to trustees that since May, trustees will know from both the anchor paper that was presented to the board at the end of May, the first and original draft of the school reopening plan that the Board of Trustees received executive summary in early June, and then a full version at the end of July, and what we presented to the Ministry of Education on the 4th of August. These are the areas that we've been focusing on. Some have been working in partnership with others, so area or category 2 student transportation. As you know, trustees, that is a service provided by a arm's length consortium from the school district. And so we're working with the student transportation for Eastern Ontario, and you'll hear from their general manager this evening about some steps that are taking place. But it was important to be able to bring them into the tent about what our conversations are, and so that they can do the same for us. Next slide, please, Derek. So the decision by the Ministry of Education on July 29th is that 52 out of the 72 school boards in Ontario will be operating in this scenario 1, which is a regular day school routine with enhanced public health protocols. This is the Upper Canada District School Board scenario that we are being directed to do. And these are some of the samples of our activities of which we're investing in at this time, including our routines around cleaning and sanitizing the school and what that would look like on a day-to-day basis once the children have arrived. We are in the process of ordering, installing, and arranging for signage, personal protective equipment, and supplies that will be necessary in order to provide the environment that has enhanced health and hygiene practices at schools, both for our students and for our employees. So it's as straightforward as, in some ways, ensuring that we have always fully stocked soap supplies and washrooms, to ensuring that we have hand sanitizers available when students enter and exit the schools, and the same for our staff. At the bottom of that slide, trustees, since the last time we briefed the board on July 22nd, we are in the process of implementing that parent survey to confirm how parents are choosing to register their children for the start of school, and we have some updates to share with you about that this evening. We have our summer wellness program that Superintendent Perry will comment on a little bit later in the presentation, including our transition support program that we're offering next week. And of course, that will continue to be a focus, and that there is an additional emphasis on preparing to receive children with special needs back to our schools, in addition to all students in our schools. And that's actually the next slide, and it's just a quick graphic to share with trustees that on the top left-hand corner, we provided the Board of Trustees with our most recent plan on July 22nd, and are in the process of updating and confirming any changes as a result of our consultation with the Ministry of Education on August 4th. On the top right-hand corner, the Return to School Guide, the first edition was issued and circulated for our staff and shared with the public on August 14th, last Friday, and will be updated again, and with new developments, including our collaboration with public health and some directions that come forward from there. If we go to the bottom left-hand corner, we are currently working on a special education companion guide that will be also part, an addendum to the board's plan, because there are a significant number of steps that we must take in order to receive a wide range of learners back into our schools that have an individual education plan and some plans of care. And then lastly, at the bottom right-hand corner, we are, of course, working on a remote learning guide. We already had one in place when we went to that model of distance learning and e-learning that we had in the board during the spring when schools are closed. Now we must revise that guide because our new reality is set by a set of expectations issued by the Ministry of Education for offering a virtual school for a minimum of 225 minutes, or I should say a maximum of 225 minutes a day for our elementary learners, and a different categorization of time for our students who are in secondary schools. So, Mr. Chair, we're going to advance to one last slide before I turn it over to Superintendent McNair. And Superintendent McNair, who is focusing on several operational requirements. The things that you're going to hear about this evening, the elements you're going to hear about this evening, is about how we're supporting our school staff and principals through our operations guide and preparing for the management of schools. Our emphasis on school and classroom routines, we want to update the board about that tonight. And also to flag for you that we continue to work with some very senior level principals through our Operations Council, which is a collection of elementary and secondary principals nominated by a family of schools who are giving us advice and have been giving us advice since the end of May on how to build a plan to reopen schools, and also, of course, as you heard this evening, public health. So I'll turn over the next slide to Superintendent McNair, and then from there, Mr. Chair, you'll hear from a number of different staff about our measures that we have in place.
Thank you, Director Sliwa, through you, Chair. Thank you for joining us this evening, everyone, to provide a bit of update on where we are heading in terms of our return to school guide as it pertains to school operations. We are in partnership, as Director Sliwa alluded to, and you've heard from Dr. Paula and Dr. Paul quite regularly with the 2 health units. We are creating an environmental scan or checklist for school sites that will be provided to all of our principals to work with their school staff, including custodians, office staff, all QP staff and all teachers, so that we can ensure the environment is prepared and ready to receive our students that choose face-to-face. We are also, as outlined in our return to school guide, we have indicated some information pertaining to arranging a classroom and what the physical environment should look like, keeping in mind, as the 2 doctors shared with us, the importance of physical distancing in the class, and of course mask wearing for mandatory for our grades 4 to 12 students. We have implemented that each of our schools will have a wellness room located in the building. They will also designate a washroom to be connected to that wellness room, and we are outlining specific guidelines for our school staff so that if a child presents symptomatic and or a staff member presents symptomatic, that we have procedures in place that our school will follow so that we can ensure that we have cared for the child, and will be reporting back, as the doctors alluded to, with public health following their outbreak protocol when students are symptomatic or in some cases require testing. We have ordered our PPE that is arriving at our schools daily right now, and our wellness rooms will be equipped with PPE, as will our staff. They will receive the required PPE as outlined by the province, being the mandatory medical masks, as well as face shields or goggles if they choose. As outlined also in our guide, you will see some information on water fountains. So filling stations, filling water fountains will be available if they are already in place in schools. And we certainly will be encouraging families to send limited belongings with their child each day, but the essentials that they need, including a water bottle, any items coming to school being labeled so that your child will be able to use and have access to his or her own belongings. You will also notice that we are allowing at this point our play structures to be open in a cohort manner. So our schools will work with their staff and designate a plan. So when our students are outdoors, and we certainly are encouraging as much outdoor time as possible, that students will be able to access the play structures as laid out at each individual site. We were going to hear a little bit more a little bit later from some of my colleagues, but Director Slew already alluded to the models that we will be having all students that choose, all families that choose for their child, the face-to-face model in elementary and secondary, and then of course the virtual school. Outlined as well in our plan is information that we will continue to practice our safety drills. So that would be our fire drills and lockdown procedures. And of course, as always, we'll work closely with our community partners, police and fire department on these procedures. At this time, we will not be permitting any physical field trips to happen. There are lots of virtual field trips that teachers may choose to access and create within their classroom cohort. So that option will be there for teachers. To begin the year, we will not be having our students participate in the inter-school sports. So if a cohort within the school wants to create intramural within their class, then that option will be available, but inter-school sports will not be occurring to begin the school year. The next slide, please. We talked and mentioned about the masks. I also wanted to reiterate the importance of frequent hand washing and hand sanitizing, and that will be some of the work that we will be guiding our staff through our principals tomorrow, and then our principals will be working with our staff on the upcoming PA days to create the various routines and expectations that should be laid out within the school, but as well in the classroom, encouraging the frequent and regular hand washing first and foremost, and secondly, of course, hand sanitizing may be required at times as well. Schools will be looking at their particular safe arrival and dismissal procedures, and that may include staggered times, as well as potentially having multiple entrances available for allowing students to enter and exit the building, continuing to promote physical distancing, of course. As I think Director Slew alluded to, we have many signs and markings for the school arriving again daily, and principals will work with custodians to place those proper signage in areas that make sense for their school and help to kind of direct the traffic flow that will occur. And as mentioned as well, we are working very closely with public line for us, and I think it's pretty close to finalized. We'll be sharing it in the very near future, a flow chart and step-by-step process of the outbreak protocol that we will certainly adhere to if a case or situation arises in our school. And the importance to us is obviously the health and safe daily routines for our students and our staff, and we will continue to work in partnership. It's a shared partnership and shared responsibility for all of us in order to maintain a safe and healthy school. So I think at this point, I will be turning it over to my colleague, Mr. Hobbs, to continue on from here.
Thank you, Superintendent McNair. Again, my name is Jeremy Hobbs, and I'm the superintendent responsible for the facilities department and the physical plant. As many of you know, we have 84 schools, elementary and secondary, and these have been constructed over a long period of time. So really, we don't, there's not much in common between them, but they all do have air handling systems, and we're really now in the facilities department focusing on two major areas of looking at those air handling systems. One is around optimizing airflow within schools based on the recommendations of the local health units, and of course the capability of the systems themselves. And we're also looking at secondary filtration of air based on the capabilities of the mechanical systems. So some of the other measures we're looking at are investigating the feasibility and desirability of complementary measures like using targeted use of portable filtration systems. So really what we're doing now is the facilities team has sort of set up a common checklist, if you will, of strategies that we can employ across our district to optimize both airflow and filtration. And then they're working through school by school based on those unique and different HVAC systems in the schools as to how we can optimize both airflow and filtration at every individual school based on the unique characteristics of the mechanical systems at that school. So moving forward to the next slide. As I mentioned, the UCDSB has 84 schools. I can, to just give some examples of the things we're looking at in terms of optimizing the systems. First of all, we're making sure that we have staff that are at each site that are fully trained in the operation of the systems and the building automation systems. We're actually maintaining detailed logs of unit maintenance and filter changes at each site. We're looking at making sure that we've got the most efficient particle filter that is suited towards the system at each site. So that's necessary for the filtration of the air. There are things we can do around scheduling purges of the HVAC system before and after school. And so those are going to be optimized and extended at the sites to make sure that kids are arriving at school to air that's been freshly turned over. One of the other things that we do with our systems, which of course are optimized for thermal comfort, unlike perhaps a hospital setting that would be optimized for pathogen filtration, is that we're actually reducing the amount of recirculation. So oftentimes what will happen is interior air gets recirculated through the actual HVAC system. And what we're doing is reducing that recirculation. So really increasing the proportion of fresh air that's coming into our schools. We're setting a schedule for our HVAC systems to run for 1 week prior to school opening, so that again, we're really making sure that the air is exhaustively turned over in our schools. Where possible, we're working on increasing the washroom exhaust schedules to extend that so that when kids are in isolated areas like a washroom where there's no windows, we're making sure the air is being turned over there. There's also, we understand from our work with other school boards and organizations like OMC, which is the Ontario Maintenance and Construction Association for School Districts, that maintaining appropriate relative humidity in schools is important. So we're working on, where possible, making sure that we maintain that within operational ranges. And we're looking, of course, at windows and making sure that we have mechanisms to pull outdoor air into the school where possible. And then finally, I think one of the things that is very difficult is people have talked extensively about the importance of proper filtration in our schools. And the only problem is that it's very difficult to characterize what proper filter or proper air ventilation is. And at many of our schools, we actually have CO2 or carbon dioxide control sensors as part of our mechanical systems. And what we're going to be doing as much as possible is monitoring those CO2 control sensors as a proxy for determining whether or not we're turning over air effectively or not. So these represent the measures that we've identified as the major strategies for making sure that we're getting appropriate ventilation in our schools. And we've actually got a logging system now where the team is working through school by school on those measures and making sure they're up to date and our systems are functioning at their designed optimal sort of capacity. And finally, as I mentioned earlier, clarification is being sought about the desirability and impact of other measures. So Dr. Stewart earlier referred to some of the air circulation, and that was in response to a request I brought to her in the last day or so. We're concerned in some respect about making sure that we don't start employing measures like the use of fans in classrooms. And as you know, COVID is spread by droplets, and so the whole point of social distancing is that those droplets descend out of the air within 6 feet or a period of time. And what we want to do is avoid using mechanisms like fans where possible, where we're going to increase the circulation of those droplets. So one of the things we're very focused on is making sure that we don't put in any measures that are going to actually reduce the effectiveness of some of the other protective measures that we're already taking. And again, one of the things I did mention was the notion of portable filtration units that are appropriate for the large sizes of space that we're working with. We're looking at acquiring some of those for those areas that are more difficult to get appropriate or satisfactory ventilation into. And that represents really at the State of the Union with regard to how we're approaching ventilation in schools.
Mr. Chair, through you, I just wanted to move to these next two slides before Superintendent Coombs comments on the quadmester model, that it will be the focal point for our secondary school program delivery. I just want to remind trustees that in March 2020, before schools were closed, our secondary school programs really had two basic program delivery components: an in-class component, which was the overwhelming majority of our students taking courses in our school system, and then an e-learning secondary course credit component, which is asynchronous or not delivered in real time necessarily in some of our schools for some of our students, where especially in our smaller schools where the timetable was more constrained. In our next slide, Derek, if you wouldn't mind, I want just to highlight how that looks now as we're moving into September. And you'll see that there are now at least two additional layers. And that is, yes, we have still our in-class regular day school program. We still continue to have a distance learning, excuse me, or asynchronous secondary school e-learning credit course. But now we have also the responsibility of providing families with the option of remote learning, which is, again, 5 days a week, 225 minutes a day, or roughly a 6-hour day. That is either synchronous with video and audio, or for some families, based on their tech capacities, synchronous with audio only, or for some other families, it might be synchronous audio versus via their landline and how they would participate in that learning. And then lastly, we have, as you know, Mr. Chair, a very complex geography that Upper Canada School Board serves. Not all families have the ability to access cellular or internet service. And so for some of those families, we continue to have the obligation to provide a remote learning option with what would be really workbooks or booklets, not unlike what was done some years ago through the correspondence courses that were offered to secondary school students. And you know, Mr. Chair, we had almost 2,000 families that were requesting those booklets in grades K to 12 from the March to June period. Next slide, please, Derek, and I'll ask Superintendent Coombs if he could carry on to speak a bit more about the quadmester model and its particular features, because that is new to the board since our last update, and we want to make sure that trustees are clear about its features.
Thank you very much, Director, and through you, Mr. Chair, good evening, everyone. As Director Sliwa mentioned, we will be implementing a quadmester structure for this coming year. And like our regular structure of 2 semesters per year, of course, we will now be having 4, where students will be taking 2 classes a day. The school year remains the same, just divided again into those 4 parts, hence the name. Each quadmester is about 48 days in length. It does allow for face-to-face instruction all 4 periods over a traditional semester. It minimizes transitions and it enforces cohorts, and it allows for easier continuity of learning if schools are required to move into remote learning anytime during the year. It also allows, and I think this is really important, students to change from a remote learning method to face-to-face should they choose, rather than having to wait to the end of a traditional semester, which is late January and early February. They can now do so in early November if that's what they choose, and again in the springtime. Could you please advance it? And so structurally, each site is different. We have large schools, medium-sized schools, and some very small schools. Principals will be structuring their cohorts into pods or geographic locations in a school where a group of students stay, or a cohort of students. Traditionally, in high schools, as you probably remember from your own days, school hallways can be very busy places, and we will be putting structures in place so that that congregation in the hallways is minimized as much as possible by keeping kids within cohorts. Move forward, please. Just a quick breakdown regarding the quadmester schedule. Quadmester again will run from September. First day of school is September 4th. And will run till early November, with exam days running on November 6th and 9th. Quadmester 2 will run from November 10th into January, and exams run at the end of Quad 2 from January 27th to 29th. Can we advance the slide, please? And this, of course, is the quadmester schedule for 3 and 4, which would be the traditional second semester. Advance the slide, please. Just wanted to point out with the day schedule, I'm sure there are questions regarding lunchtime breaks, that kind of thing. The schedule will allow for staggered breaks over the course of an initial block of time. And so we're talking about 150 minutes of instruction per day per course. And so students will still receive a 10-minute break in that 150-minute block of time, but it will be staggered, so all students are not moving at the same time. And also we have a different schedule for half the school, which will stagger the lunchtime. And lots of questions regarding lunch. We are keeping our cafeterias open in that we will have services available on a grab-and-go scale, so there won't be long lines at the cafeteria. We absolutely want to encourage students to stay in school over lunch, and there will be a staggered access to cafeteria. There will also be other areas, open areas of the school per cohort, which is open for students to have lunch. And so with staggered breaks, staggered lunch, minimal access to the cafeteria, and with more spaces open for students to have lunch, we will be endeavoring to keep kids within their cohorts and to lessen contact between students in the entire school. Thank you, Mr. Chair. I'll pass it back to you.
Mr. Chair, next up, we are just going to ask Superintendent Perry to speak briefly to the special education focus and transition for students. We're just going to position that slide back, and there it is there. So over to Superintendent Perry.
Thank you, Director Sliwa, and through you, Mr. Chair. The Special Education Department has continued to provide various services throughout this summer. We had special education supports in place for students with special education needs who were enrolled in the summer learning program. We also had special services counselors on duty through the summer to support mental health. 78 of our schools will be participating in transition supports for students with special education needs. Those students would have been identified by their schools as needing additional practice for transitions. These sessions will be in face-to-face format, and they're going to involve staff from each one of the schools. The practice of health and safety routines, information and activities about mental health and wellness, and most importantly, welcoming students back to school will be emphasized. We had training today with all of the educators and provided them with different resources and materials for use in the program. The central team within special education has been working very diligently throughout the summer to prepare materials, and we are very thankful to our central team and all of the educators who have accepted the challenge of the summer transitions for our students at the school level, and the excitement was evident today. We have educators who are wanting to be back in the classroom and with their students, and so next week we will be receiving a large number of students into different sites throughout the district. Going forward, we are set to publish a companion guide for to the reopening guide that we put out last week, and the companion guide for special education and student mental health and wellness will be publicized tomorrow. It's a guide that will provide a little bit more operational guidance on what it is that we're doing within the special education department. And we will, as always, be working with all of our schools to support students with special education and mental health needs to ensure that they are welcomed back into a safe and happy learning environment. Thank you.
Mr. Chair, we'll close off our presentation with hearing from Superintendent Rudders, who will update the board on the remote learning focus and also some up-to-date results as recent as at 12 noon today regarding the parent survey. So over to Superintendent Rudders.
Thank you, Director Sliwa, and through you, Chair, I'm pleased to be able to provide some updates on remote learning coming up this fall and the Upper Canada District School Board's newly created virtual school. Certainly you are aware, parents and trustees, that we have been engaging in a parent survey to determine the needs of our students in terms of access to remote learning. And so we will be bringing forward a remote learning guide as a companion to our return to school guide in the next version coming out within early next week, where we can give some more specifics about the elementary program features, the secondary program features, and the timelines. And we'll also review some of those here in this presentation. Next slide, please. So far, as you know, our survey closes tomorrow at 11:45. At this point in time, we have had response rate has been, as of this morning, we had 14,433, or 55% of our total Upper Canada District School Board projected enrollment had completed the survey. Of that, 57% of our projected enrollment for elementary have answered, and 50% of our projected enrollment for secondary have answered. And so far, there are 2,446 students who have opted for remote learning at home. That's 17% of our responses so far, and that represents 9% of the projected enrollment of the board. Next slide, please. And so by program, if we break it down into the elementary panel and the secondary panel, of the 2,446 students who are opting for remote learning, the majority are elementary students across the board, and 1,790 students, which represents 10% of our projected elementary enrollment, and 656 students, which represents 8% of our projected secondary enrollment for schools. Next slide, please. So the organizational structure for the virtual school, we are Organizationally, the virtual school will be under the umbrella of Tierra Leger. We are creating for the first time an elementary virtual school and a secondary virtual school. And students will be cross-enrolled from their home school to the appropriate virtual school and into their class or their courses. Any student who has not indicated in the distance learning survey by tomorrow, our assumption will be that they are returning to face-to-face learning. That doesn't mean that you can't still let us know if there is interest in moving into virtual learning, but students who notify us after the August 20th survey closes that they wish to engage in this virtual learning or distance learning, we will certainly accommodate that, but we may not be in a position to have that placement intact for the very first day of instruction. Next slide, please. So to give you a little bit of detail with regards to the virtual school elementary, our students in kindergarten to grade 8 who choose to learn fully online from home will be assigned to a single class. And each class will have an assigned teacher, and the students will be provided with a daily schedule of subjects according to the 5-hour instructional day. And we now understand, with recent communication from the ministry last week, that of that 5-hour instructional day, that 180 minutes for kindergarten students would be combinations of synchronous learning with the teacher, and that could involve some direct instruction, large group activities, small group activities, office hours approach where parents and students can engage individually with the teacher, and a variety of different chunks throughout the day. So not at all is the intention to be that the synchronous learning would be a straight period of 180 minutes. In grades 1 to 8, that period of synchronous instruction is 225 minutes, once again broken up with a variety of different activities that involve connection with the teacher, large group, small group, individualized, and again broken up over the course of the day. The teacher will not be from the student's home school, but will instead be assigned centrally to be a teacher in the virtual school. We will be offering the French instruction according to the programs that students have registered for, core or regular program and immersion. And students who choose to change from one learning model to another will have the opportunity to do so on predetermined dates at approximately monthly intervals throughout the school year. And those dates in our updated remote learning guide, those dates will be spelled out very clearly when that document goes out next week. Consideration would be provided for special family circumstances that require a more expedient move from one program to the other. And so we would examine those on a case-by-case basis. Next slide, please. So our virtual school organization for secondary, the secondary virtual school program will be aligned with the quadmestre model being implemented at our face-to-face secondary schools. So that means 9 weeks to complete the 2 credits that a student would be enrolled in the virtual school. The secondary students who choose distance learning will be assigned the 2 online courses, and we will engage in a course selection process which will occur with each student who elects for full distance learning and will be informed by the existing student timetable at the mainstream school. So we know that principals in mainstream schools are needing to make some adjustments to their timetables, but we will be reaching out to them after the survey closes to determine what 2 courses a student who is registered for distance learning would have been taking had they been in a face-to-face model at the home school. We feel it's really essential that, particularly for compulsory courses, that we match up what the student would have been doing face-to-face with what the student is enrolled in the online environment. And then there will be a selection, should the student have had an elective course, there will be a selection of elective courses at each grade level that would be appropriate for and well easily delivered within a distance learning or an online environment. And so that's where we would be reaching out to families to confirm what course and if there's a place for a choice in the student's timetable, then we would be inviting your input as a family on that. And so secondary students who wish to return to face-to-face learning will have the opportunity to do so at the beginning of the next quadmester, which will be, of course, early November, and once again at the beginning of February, and then once again midway through what would normally be our second semester. And of course, if there's a situation where there are special or unique family circumstances that require a more expedient move, we will certainly take that under consideration on a case-by-case basis. Next slide, please. So just to give you an idea of our registration timelines, on August 20th, the student survey closes, which is tomorrow. We will be able to sort that data and receive and review it by the end of this week on Friday, August 21st. And of course, across the week next week, we will be looking at that data, organizing and creating the classes for our elementary students in the virtual model, engaging with our secondary schools to consult around course selection needs for our secondary students who have enrolled, and then determining staff assignments with staff who will be permanent staff who will be working within the virtual environment, and then of course posting any additional required positions to fulfill the needs of our students in the virtual schools. We would like to ensure that we reach out to parents who have answered their survey and have indicated their interest in remote learning, and we intend to do that by email early next week. And then once we've established timetables, we will confirm by email class placements for both elementary and secondary. And we'll also be providing a student parent guide for remote learning and directions for how to get into the course on the first day. Next slide, please.
Hi, it's Jeremy Hobbs again. I believe this one is my slide. Again, superintendent with responsibility for the information technology function. So as many people will recall, back in the spring of this year when schools initially closed, we made an effort to redeploy some of the 20,000 or so technology devices that we have in our inventory out to students who needed them to actually complete their studies remotely. And at that time, we pulled about 2,000 mobile devices from our inventory. We wiped them and reconfigured them for home use and loaned those out to students. And now as we're spooling up for a start to remote learning this year, what we want to really do is make sure that students who are choosing the remote option and do need to have a board device on loan to them have the best possible experience. So what we've done over the course of the last few months is purchased approximately 1,400 brand new devices, and we are actually readying those for distribution out to students who need loaners. And that's something that will be, that distribution process will be kicking off in the next few days. With regard to those 2,000 devices that are already out there, what we'd like to do is recall those back in, wipe any personal information off them that may remain on those devices, refurbish them, and to some extent return them to the schools from which they were loaned, so that they can resume the instructional agenda for kids at those schools who are in schools. And there also may be a portion of those that may be, if they're needed for supporting remote learning, we could actually make those available for remote learning as well. In addition, we also have budget set aside in the current or in the upcoming 2021 fiscal year to purchase approximately 1,000 additional new devices should they be needed, as well to support remote learning or learning in schools as well. So we feel that between the personal devices that sometimes students will choose to use rather than school devices, in addition to the devices that we have in schools, the number in the neighborhood of around 20,000 now, and the devices that we have available for loan will be well positioned to support the remote learning needs of our students as well. What can be a little more challenging, however, is connectivity, because we do know that connectivity is not necessarily evenly distributed among all of our areas across our broad geography. And to be quite frank, the Upper Canada District School Board, like municipalities or other government entities, has little often to say about the construction of that infrastructure where it doesn't exist. However, there are some strategies that we think that we can employ to assist students that need connectivity support in participating in synchronous remote learning. So one of the things we've done over the course of the past few months is purchased 300 new what we call Kajit Smart Spots. This is just a brand. Basically what it does is provides a Wi-Fi hotspot using a cellular data connection, so very similar to the way your phone would receive the internet. And those where connectivity is available, we'd be willing to look at deploying those to students who need it. There are a couple other measures that we're looking at as well that may be able to assist with participation. And one of those is just having people participate in synchronous learning by old-fashioned telephone landline. And that's something that we feel that we can do through a change to some of our licensing model for remote learning teachers. But generally speaking, we have a good plan here. I think we're going to be mobilizing this in the coming days to both get those old devices that we had on loan back in, get them refurbished and redeployed, and then deploy those brand new devices out to students who need it to support the remote learning agenda, as well as the connectivity options that we've put together to date and those that are still in development. Thank you.
Thank you very much, everybody. We are out of time on this segment, so I'm going to, but there are 4 trustees who have questions. Could you ask your questions very quickly and get a very succinct answer? Trustee Cram?
Thank you, Chair. That question goes to basically Superintendent Coombs and with a little overlap to Superintendent Rudders. When we're establishing the virtual classes or the remote learning classes, what kind of effort are we making to include the same students in this, the students from the same schools to be put in the same virtual classes?
Trustee Cram, it's Susan Rudders. I can speak to that. So it certainly is our intention when we download the information from the survey, we will be able to sort by school. And so that will provide us with the opportunity to the best extent we can, try and bring students together in the same class who may have a pre-existing relationship because they have attended the same school. Particularly in secondary, we will do so to the greatest extent we can, but it will be dependent upon the 2 courses that the student is scheduled to take and how that aligns with other students who may also be from their same school.
Thank you. Trustee Swan, quick question.
Yes, I'm just wondering what we're doing about our itinerant staff. I mean, having them move around can also affect our students. So positions like library techs, financial assistants, speech pathologists. I'd just like to know, and this is for the director, I'd like to know what we're doing to minimize travel for them to protect our students and staff.
Mr. Chair, through you, I'll begin. I'm just going to ask Superintendent Person to comment as well. We consulted with Public Health about the question about itinerant staff, and it was their view that as long as that they were following the proper hygiene and health protocols, that there was not any greater risk, and that we would need to build their time into our schools so that to minimize the amount of transition. So they will be at less schools, stationed for longer periods of time, and also using virtual means to connect with either teachers or students to support the work that they're required to do. I'm just going to ask Superintendent Ferguson to comment any further based on our last conversations or conversations he's been involved in.
Through you, Mr. Chair.
Go ahead.
Thank you. So as the director mentioned, we did have conversations with the chief medical officers of health regarding this. It also applies to our occasional staff who travel throughout our district and around to different schools. We have some collective agreement requirements that those folks be allowed to do so. In our conversations with the chief medical officers of health, they did state that at this time they felt it was acceptable for those staff to continue to move around, but they also stated that they would not hesitate that if something changed with the status of COVID-19, that they would enact that. And as I think folks are probably aware, if they make such an order that is binding and it supersedes and overrides collective agreements and any other requirements or legal obligations that are out there. So at that point, if they did make that order, we would follow that, of course.
Thank you.
Final response from the director.
Mr. Chair, through you, just also want to comment as well. All Upper Canada District School Board staff are required to self-assess for any COVID-19 symptoms daily, and that will be part of our internal protocol for all staff, and that will also help to mitigate risk for any itinerant staff that may find themselves working in different school sites over the course of the week.
Thank you. Trustee Schooler?
Yes, through you, Chair. Has there been any discussion around whether there'd be any operational or medical advantage to a delayed start to the school year or a staggered start to the school year?
Director Sliwa?
Mr. Chair, through you, I'll begin, and I'm going to ask Superintendent Rudders to comment as well, since she's working on this model. We are currently looking at, Mr. Chair, the how we can use some of the permissions granted by the Ministry of Education yesterday and last Friday. We're consulting with our principals right now about what their best advice would be and how it would advantage students and staff to become better familiar with the new routines that we are implementing at schools. And I'm going to just ask Superintendent Rudders to comment any further if I've missed anything.
Thank you, Director Sliwa. I don't believe you've missed anything. I think that we're balancing in our considerations on this topic. We're really balancing our desire to ensure that our students and staff have the opportunity to practice the safe hygiene routines and the safe arrival routines that are so necessary right now. I'm trying to balance that understanding with, of course, our obligation and desire to have our students return to learning as close to the beginning of the school year as is reasonable. Thanks very much.
Mr. Chair, I also would like to add that knowing that we are working against a very tight calendar, we'll be updating the board and parents and our staff of if there's any change made to the school year calendar. And while the ministry does not require a formal request to do so, we understand that families and our students would like to know whether or not we're moving to that staggered start. We'll have that finalized no later than next Monday, and we are currently working on that with our senior team and our senior principals.
Thank you, Director. And final question to Trustee McPherson.
Thank you. A common theme tonight is the student masking, mandatory grades 4 to 12. It's mentioned in all three presentations from the health unit right through to Steele. I also see it in the questions list. I'm not going to use the word enforcement, but what protocols are we prepared to put in place to ensure as much compliance as possible? Would it be the same as a write-up in a discipline book, or what process are we putting in place? Thank you.
Mr. Chair, through you, I'm going to ask Superintendent Perry to comment because she's been working on this particular aspect along with Superintendent Coombs.
Thank you, Director Sliwa. I apologize. I had a glitch in my my headset. I've switched headsets here, so I missed the question. I do apologize.
Superintendent Perry, the question is about what measures are we taking at the school to help acclimatize students to the importance of wearing masks and to bring upon students the importance of needing to do that daily, and how we're helping students who may have not an initial comfort to wear masks, how we're helping to support that, especially for grades 4 to 12 and the masks are mandatory.
Thank you, Director Sliwa. Through you, Mr. Chair, I can give an example from the Summer Transitions Program. We have a number of different supports that we're providing to educators that are going to be available for all of our school staff to be able to support children in terms of how to take on a mask, how to put the mask on, how to take it off, how to properly wash their hands, etc. Modeling from the staff is going to be very, very important as well. And I've been watching children in public, and children seem to be adapting quite well. So taking a look at the modeling that the adults are providing to children is probably the biggest key in how our children are going to adapt to wearing a mask. So in the transition supports that we're offering through next week, we have a number of different activities, materials, resources, videos, and supports that are being put into place to help our children understand why these measures are necessary, how they're protecting themselves and how they're protecting others, and essentially why it's necessary and what we can do to essentially help everybody in what we're doing.
Thank you very much.
Mr. Chair, I have a question.
Excuse me,
No,
that was not
I'm
the
sorry.
question. The question was what was going to happen if people didn't wear masks.
Ladies and gentlemen, that is the final question. We
That's
are
all.
now moving to the presentation from Janet Murray, the CAO of STAO. Ms. Murray, you have the floor.
Thank you. Thank you very much for including us this evening and giving us an opportunity to speak to transportation considerations. I am mindful of the time, so I will endeavor to keep my comments very high level, and we can certainly tackle any questions that you may have at the end of the presentation. I should mention that I do have on the line as well Mark Gasset, who is the operations manager for STEO, and so if you have any questions specific to routing or operations, he is also here to support that information as well. And I will say that some of the components of the presentation were also spoken to by Drs. Remiliotis and Stewart, and we appreciate so much that they've touched on those items. I just have to emphasize some of the comments that have been made earlier as relates to just how accountable and engaged our local health authorities have been in these unprecedented times. We rely on them heavily and we ask them questions big and small, and they are entirely quick and responsive and detailed in the information that they provide to us, and they are sincerely appreciated. So thank you to them this evening. So here tonight, we're just going to speak to very high level STEO's COVID-19 transportation response plan. This is a plan that is posted in detail on STEO's website, and so it's accessible there if you want to dig and delve into some of the details. And we know that while learning and online learning and remote learning has been at the forefront of parents and families' minds since March, transportation maybe hasn't been, because of course school was not at all in session and transportation was not necessarily a factor. As we approach the return to school, it is now becoming certainly an issue and a question that more and more families are looking for answers on. So I'll start here with collaboration and consultation, and just very quickly to assure everybody that, you know, although sometimes transportation seems to operate a little bit in a silo, that is certainly not the case, and it's definitely not the case as relates to the COVID-19 transportation response plan. Throughout the spring and throughout the summer, we have been working extensively with the Ministry of Education, of course, with our local school boards, and we service Upper Canada District School Board as well as the Catholic District School Board of Eastern Ontario. We've been in frequent contact with our board partners. We're also in contact with our school bus operators, who are, you know, frequently speaking to us about their concerns and constraints as relates to their own staffing issues and hardware and software and bus driver issues that may relate to the constraints in terms of transportation during a global pandemic. We're working, as I mentioned, very closely with the local health authorities who have been integral to the planning as relates to our transportation response plan, and also with our neighboring consortia across the province to ensure that our interpretation of the provincial guidelines is something that's being implemented really across the board. So we have been very much enmeshed and connected with a lot of community partners in the development of this plan. And as the boards have indicated themselves, we will remain responsive to guidance from the ministry. And we know that this is sometimes a moving target and that it's important for us to be responsive. And so as our local health authorities and Ministry of Education provide us with guidance, we will continue to augment the plan as necessary, and we will meet or exceed the safety standards as dictated by that guidance. And that is something that our plan currently does, meets all of the expectations of the Ministry, Transport Canada, and the local health authorities. And in some cases, we've exceeded those as well. If I could trouble you to go to the next slide, it would be appreciated. Thank you. As it relates to opting out of transportation, it seems odd, I suppose, for a transportation consortia to speak to looking for families to opt out of transportation, and in some cases even encouraging them to do so. There's a rationale for that, and I'll give you some context for that. So if eligible families are choosing not to access STIO's transportation, and that's of course both families who are not going to be attending in person, but also families who may be attending in person, but ultimately deciding to seek alternate transportation solutions like active travel, for example, or perhaps private transportation. We are asking that you opt out as soon as possible through the surveys provided through your school board. The opting out component of the surveys that your boards have reached out to does bolster STIO's ability to reduce capacity on school vehicles to support social distancing. And I'll talk a little bit later about what the capacity considerations are and what the provincial guidance on that is. But again, certainly where families do have the opportunity, and we know that is not necessarily an opportunity for all families, but where the opportunity does exist to seek alternate means of transportation to school, that does provide us the opportunity to balance and reduce loads on the school vehicle, which does have some strategic health advantages. We should note that in the opting out process that eligible families will have the opportunity to opt back into transportation services as their personal situation may change or the local or global situation may change, and they can do that by contacting STIO directly. Thank you. I made a quick reference to alternate and active transportation. So again, it is recommended, and this comes from the provincial guidance as well, that students who can would use active transportation to get to school, walking and rolling to school, for example, where it can be done so reasonably and safely, of course. And something else to be mindful of as relates to active transportation is it might not be your entire route to school, but we do encourage the concept of walk-a-block to reduce traffic around the school. What happens is when folks get off the bus and access private transportation to a greater degree, parents, taking their kids to school in their own personal vehicles, what happens is you can have school loading zones which become very congested with parent traffic, and that comes with its own health and safety risks associated with it. So as part of this process where we're beginning to discuss and engage in conversations about opting out of transportation, we also want to be mindful not to create other issues or risks to health associated with congesting an already busy and populated loading zone at the school. So we're encouraging families to try parking away from the school, maybe having your children walk the last block or two. And this is a really great time of the year as we lead up to return to school to plan your route, find the 5-minute walk zone around your school, and actually practice that with your children so that the first time they're doing it isn't the first day of school, which is already sort of fraught with change, particularly in a year such as this one. Next slide, please. In terms of parent and guardian responsibilities, again, these are unpacked to a greater degree in the fulsome document, which is available on STEO's website. But this is really largely reiterating what a lot of our health authority partners and the school board folks have already said, which is how important it is to assess your child's health and that of all the members of your household before sending your child to the bus stop. So rather than mitigating something on the bus, which is our concern, of course, or in the school itself, to maybe preclude its entry altogether. And again, we're advocating for use of the self-assessment tool. The link, of course, is here, but I'm sure you're all very familiar with it at this point. And again, practicing all of those other mitigating factors that sort of form part and parcel of this strategy to reduce the spread of COVID-19, which is, again, supporting your child in washing their hands prior to leaving the home for the stop, and then providing them with a hand sanitizer for personal use if possible, recognizing that the school bus has a lot of high-touch surfaces, and having something in terms of a personal hand sanitizer on hand can help mitigate risk in that regard as well. Next slide, please. I want to point out that we do know that this, we have a lot of safety materials available on STEO's website, and we have first-time rider videos and wonderful safety videos that speak to what transportation looks like and what transportation expectations are under, quote unquote, normal circumstances, which we know these are not. And so we are preparing a video to help orient students and parents and guardians to what the new expectations on the school bus will be. I anticipate that that video will probably be available tomorrow. We were just fine-tuning it today, and sort of now that we have some final details around exactly what those expectations are, we're just sort of putting the finishing touches on it. It does feature live little human beings boarding school buses in masks, and it's helpful in that it sort of demonstrates what the driver might look like in their personal protective equipment when the student boards the bus, which is, although it's becoming something that we're used to seeing in the social landscape, certainly for young riders and maybe riders who are getting onto the bus for the first time, could be an intimidating sight to see in your first step onto a school vehicle. And so this is to help not only educate in terms of what expectations are and health protocols, but also to provide a little bit of comfort to families and children around orienting to new expectations on the school bus. We will post that to social media, and we will post it to our website, and we'll share it with the boards as well, so that that can be shared en masse for folks to have a look at before students have to anticipate getting back into the school bus routine. It also speaks to things like distancing at the school bus stop and what the expectations look like around loading and unloading a school vehicle, as well as what seating might look like in terms of seating assignments on the school bus, which I'll talk to a little bit later. Next slide, please. Masking on the school vehicle. We have worked very, very closely with our local health partners on this particular topic, and we know it's a topic of great interest, and it's come up in the presentations earlier this evening. And the bus, again, is, of course, its own unique environment. So as students may be in close contact with others for potentially prolonged periods of time on a school bus or in a school vehicle, it is strongly recommended that students in JK to 3 wear non-medical face coverings or masks while traveling on school vehicles. We know that students in grades 4 and up are required to wear face coverings on vehicles as they are in school, as per the provincial school reopening guidelines, but we will be strongly reiterating, with the guidance of the province and with our local health authorities, that we would strongly advocate for the wearing of those masks by students in grades JK through 3 as well. And as we've discussed, of course, exceptions can be made for students with breathing or cognitive difficulties, or for those who are unable to apply or remove a mask without assistance. Next slide, please. You're awesome, bus driver. And I'm throwing a bit of props out there because we understand that drivers are already tasked with a very, very challenging job, and now they're re-entering into sort of the unknown and into, just like our school staff are as frontline service providers, are entering into a new world with new expectations and potentially new risks as well. And we sincerely appreciate the drivers who are coming back to us and taking on those new responsibilities. We wanted parents to be aware and families and students to be aware that drivers will wear a medical grade mask. So that's the mask that will provide an element of protection for the wearer as well as for the individuals around them, the students in this case. They will also wear a face shield or goggles during the loading and unloading of students, and that's for additional eye protection as students are unloading, loading and unloading onto the vehicle because of the close proximity that occurs between driver and student during that process. There will also be additional PPE required for drivers of wheelchair buses, and because those drivers have a closer proximity to students during the unloading and loading process related to the securement of the chair itself. And then if there is a first aid event or an emergency event requiring a driver intervention, drivers would wear gloves, a mask, a face shield or goggles, as well as a paper gown. Operators will also do their utmost to keep the same driver on the same run each day to support student comfort. Again, we referenced that sort of in the earlier slide, but this is about safety and wellness. It's also about mental health and a student's comfort level to do these things. And the more comfortable they are, I think the more likely they are to, follow instructions and guidance and be engaged and willing to, meet their new expectations on the bus. So wherever possible, and it's not always possible, but operators will do their utmost to keep the same driver on the same run each day to support student comfort, and of course that contact tracing piece that our doctor spoke about. Seating assignments, capacity, and ventilation. Per provincial guidance, vehicle loading capacity will be at or close to normal. So this is the guidance currently coming at the provincial level that vehicles will be at or close to capacity. We are, however, making active efforts to distribute loads to reduce vehicle loads wherever we possibly can. So for example, if there's a bus that's more heavily weighted in one area and we can reasonably, reallocate some students to another school vehicle in order to reduce loads and support physical distancing on the vehicle, that is something that we are actively and strategically doing. The transportation opt-outs, which have been coming to us over the past number of days as parents sort of begin to navigate their way through this process and make decisions that best suit their children and their families, will very much assist in this process and is assisting in this process because it does reduce ridership and allow us to exercise greater flexibility in implementing distancing on the school vehicle. In addition to those measures, the seat directly behind in the large bus or beside the vehicle, beside the driver rather, in a van, will be left vacant. So there will be no riders put in those seats, again, to support some physical distancing for drivers and for students. Seating assignments will be a critical and crucial part of the path forward for September. And again, this is going to support some of the elements that the doctor spoke to, including contact tracing. Students who live in the same household will be seated together through that process, while single riders without siblings, will be grouped with classmates to the extent possible with their classroom cohorts. Seats will be clearly numbered or marked, and we're just now sort of making the final details of our plan for bus operators, which we have reviewed in draft format with them around their expectations for September. Part of those are going to be that the seats are clearly numbered or marked so that students can find easily their seats and will stay. The expectation will be that they'll stay in their assigned seats during every ride. So again, this will reduce germ spread, facilitate contact tracing because we'll know where students are seated each and every time. Our ventilation system is somewhat less sophisticated, but whenever feasible, bus windows will be open or partially open to increase vehicle ventilation. Of course, there will be a weather-dependent element of this, and it will be implemented under the direction of the bus driver. Next slide, please. Some reassurance around vehicle cleaning and disinfection. So a hard surface disinfectant for use against COVID-19. I have a little human with me right now. A hard surface disinfectant for use against COVID-19 as authorized by Health Canada will be utilized on high-touch areas, including handrails and seats in between each school run. So where different schools are being serviced, that's going to occur. And then an enhanced cleaning and disinfection to handrails, seats, seat belts, windows, the walls below windows, the steering wheel and driver controls, and any other part that is commonly used and that may have been touched will occur twice daily following the completion of each shift. And again, that is in compliance with the direction from the province. Next slide, please. Yeah, just to finish, we are here. We know that there are lots of questions and that parents will have lots of questions in the context of these changes. We have been here all summer working hard. We will continue to be here right up until school begins. Our fulsome plan is posted at the website at sto.ca. Our telephone number, our toll-free telephone number is posted there as well. And that's our inquiry email for individuals who may want to reach out with questions. We will answer them quickly and to the best of our ability. Thank you.
Thank you very much, Janet. I'm going to ask Trustee Cram to ask his question, please.
Thank you, Chair. Although my question is basically answered by Ms. Murray during the presentation, but I do have a concern on the capacity of students on the bus, and I know it's a cost factor, but I would strongly encourage STAO to look at having less than a full capacity on buses wherever possible. And I know you did make that statement during the your presentation, but again, I really have a concern on full capacity on the buses.
Any comment, Janet?
Yeah, through you, Chair, we certainly hear that concern. Again, the capacity is being implemented according to the provincial guidance, but we are making efforts to reduce that capacity or certainly to balance loads wherever it is feasible for us to do so.
Thank you. Trustee Pediatric?
Hi, thank you. Thanks, John. Mrs. Murray, I have one question for you. Has there been, or have we looked at some of our districts share buses between school boards, which could potentially, you know, as we have more children in contact in more places, have we looked at mitigating or reducing students that go to multiple schools sharing busing or seating arrangements on the buses?
Mark, are you able to speak to that?
Well, while Mark tees up an answer, I'm going to go to the next question and we'll come back to that. Okay, Trustee Parisier? Trustee Swan.
My question was very similar to Trustee Parisian's question, was in regards to we're implementing new boundaries in our area in bell times, and we're picking up two different schools and the Catholic board as well. I just wanted to know basically the same answer is, are we mixing school cohorts on top of the 50 and 100 cohorts that we're supposed to be doing in our schools?
It's Mark. I think you can hear me now. I just figured out the *6.
Thank you.
Go ahead, Mark.
Yes, we are continuing to route according to the plan set out by the province. So yes, the two schools will be combined on the same bus, but a seating plan will be in place for those schools, and we will be able to contact trace on the bus.
A secondary question, because that didn't quite answer my first one. will you be having, let's say, example, school A is in the back and school B in the front?
The seating plan for the first day of school, because we don't know the cohorts or what classes they share, we will load buses from back to front. And once we figure out that seating plan, if that works, we will implement that plan and it will stay that way.
Thank you. Trustee McPherson?
Thank you. I was hoping not to ask a question during the transportation section, but my original question, I did not quite get the answer I was seeking. Bus drivers would be the first ones that will meet a student that is unmasked, and they're going to deal with it at school. I asked about the protocol. What avenue do you take to encourage enforcement? And I'm not talking about training. The whole thing about the social distancing and the COVID response is largely dependent upon masking. And I do have a secondary question after this one is responded to.
I'm going to ask Janet to answer that, and then I'm going to ask Superintendent Coombs if he wouldn't mind commenting, please. Go ahead, Janet.
For sure. Yeah, we understand how important it is sort of to speak to, you know, where that expectation is not being followed, what is ultimately, I guess, the recourse. And we know that's a bit of a sensitive topic, to be sure. We've had some preliminary discussion with the board around this, and typically what occurs on the bus where there is a safety concern, or potentially you might characterize it as a behavioral concern, is that the school bus driver would inform the school through a misconduct report. Essentially, the school principal is ultimately responsible for behavior management, other than your basic safety management, which occurs on the school vehicle, being that the school bus is an extension of the classroom. So what would happen, and what we're encouraging just school bus operators and drivers to do, is if there is an issue where there is a student who is not following safety protocols, whether they be related to COVID-19 masking or whether they be related to other safety protocols, which could put themselves or other students at risk, that they would issue a report to the principal for the principal to follow up accordingly.
Go ahead, Trustee Coombs, or Superintendent Coombs.
Thank you very much, Mr. Chair. Yeah, I would start by saying that we do, we will have an exemption process by which parents and students, for their students, can seek a reasonable exemption, and it would be tracked and monitored through the school office. And certainly STAO would be aware of those students who do have that legitimate and reasonable exemption. I think what the question really here is when it comes to compliance. So what if it's not a reasonable exemption issue, it's just a student who refuses to wear a mask? And then, as has been mentioned by Ms. Murray, it then becomes a behavioral issue and would be you know, would be dealt with in the same manner as any other kind of unacceptable behavior that could be a health risk on a bus or in a school or in a classroom. And we do have a progressive discipline policy. We do start, of course, by warning and reprimand, by notification of the parent, so that they are immediately notified that their student is not behaving, is not following accepted protocols. And then the progressive discipline goes up to and including suspension. And so, again, a student without a reasonable exemption cleared through the principal, tracked by the school office, who is simply non-compliant, will be subject to our regular progressive discipline and dealt with accordingly.
Thank you very much, Superintendent Coombs. I have a question from a parent. Janet, for you, I think. What do you recommend for parents who aren't comfortable to send their children on the bus right away, but do not want to opt out for the entire year?
Yeah, great question. I'm sure a lot of parents are in that boat right now and sort of balancing the pros and cons. It might help, I mean, to have a look at the video once we post it. Like I said, that's probably going to be tomorrow because it's going to give you sort of a visual sense. We are right on the school bus. I'm actually there with my little humans, and we had a local bus operator who helped us out with their little humans, and it's actually the process for sort of getting on and what to expect. And sometimes it's just, it's the rationale for our first time rider program that we offer, which is, until a student actually sort of goes through the motion, it can be very, intimidating to conceptualize what it might actually be like. So we sort of try to walk you through to demystify that, just like we all got used to going to the grocery store under new expectations, this is something that's, going to be very reasonable and manageable as well. It's just that it's different, and that is sometimes the challenge in and of itself. So I would orient yourself. I would recommend having a look at that, and maybe that might be helpful. And again, the opportunity does exist to opt out if you're just not there yet and you just don't feel quite ready, and maybe you want to tackle re-entry to school first and look at the bus later on. Your opportunity to opt back into the system will continue to exist. It may take a little bit of time to get you back on, just because it takes some logistical effort on our part to make that occur, but you certainly will have the opportunity to access the service again when you feel comfortable and when your family and your child is ready to do that.
Thank you. Trustees, are there any further questions of Ms. Murray? Janet, I don't hear any further questions, so I want to thank you and that little human behind you. So
I have one last one, if I may, please.
Yes, Trustee Swan.
It said all bus drivers will be masked. So if a bus driver can't mask up, does that mean they can't work because of medical reasons?
It does not. Again, we have worked very closely with our local health authority on this particular issue, and just like with students, there are certainly legitimate exemptions that would apply to the driver group as well. We are, however, going to recommend that in those cases, the driver would utilize, if they're able to, a face shield. Which does not, we understand, provide the same level of protection as the surgical mask, certainly, but it does provide an element of protection, and that would be utilized at the unloading and loading of students where the students and the driver are in closest proximity.
Thanks, Janet.
You're welcome.
Thank you very much, Janet. Ladies and gentlemen, it's 9 o'clock, and I think it is time to conclude the session. We had approximately 514 guests on this particular information session, and we had over 800 and something like 826 questions. So any trustees, any questions that you have that have not been answered that you want to ask, why don't you send them to me, and I'll redirect them to the best source, and we'll get an answer for you. To those parents whose questions have not yet been answered, we will be grouping them together, and they will be added to our frequently asked questions list. So I want to thank Ms. Murray, I want to thank Director Sliwa, and all the superintendents who are participating, Dr. Paul and Dr. Paula. I hope that you have found this to be an informative session, and I thank you all very much for having participated. So on that note, I'm going to say good night, and we will terminate the show. Good night.
Night, everybody.